Hello and namaste everyone. Welcome back once again to Offbeat Psychology, where you received so much of offbeat information. In today's video, I will be sharing with you what is the meaning of psychotherapy, who is a psychotherapist, which are the different types of psychotherapies offered by the psychotherapists, what is the difference between counseling and therapy, and also how you can become a psychotherapist in India. I will also be sharing with you some numbers about the success rate of each of the psychotherapy, and by the end of this video I will also recommend to you which is the best psychotherapy where you should try to build your career as a psychotherapist. So let's begin. What is psychotherapy? Psychotherapy is a professional intervention program, a professional way of dealing with someone who is a patient client and is suffering with some type of mental health problem, has emotional problems, adjustment problems, and so on. And the work of a psychotherapist is to provide that particular therapy in which the psychotherapist is trained, so that this client or the patient can come out of his or her problem. Okay, so what is the difference between counseling and psychotherapy? See, the biggest difference or the most important point to note here is that every therapist can do counseling, but every counselor cannot do therapy. Counseling means only talking, and therapy means providing treatment. See, only talking cannot solve the client's or the patient's issue. You also understand that only talking about something is not always going to give the solution to the patient, especially if the patient has some severe psychological problem. So this is exactly where psychotherapy is required, because only counseling and the success rate of only counseling is not very good. So which are the different types of psychotherapies offered by different psychologists and psychiatrists or therapists? In this particular video, I will be only talking about psychodynamic therapy, behavior therapy, cognitive therapy, cognitive behavior therapy, popularly known as CBT, REBT, which is rational emotive behavior therapy, humanistic therapy, dance therapy, art therapy, and hypnotherapy. The reason why I am going to cover only these few therapies, though there are many psychotherapies across the world which different psychotherapists have been using, but these ones I want to include in my video because these are the ones in which training is possible in our country. First, as I mentioned, is the psychodynamic therapy, popularly known as psychoanalysis. It is because of the work of Sigmund Freud that this psychotherapy is still very interesting, especially to the youngsters, because it does not talk about only the external behavior of the individual. It talks about what goes on in the subconscious level of mind of the person. So according to this psychotherapy, there are three levels of mind: the conscious, the preconscious, and the unconscious. So conscious is everything that you are dealing with currently in your brain. So you are listening to my voice, maybe there is fan going on in the background, you can hear the noise of that. All that is in your conscious level. The preconscious level includes the long-term memory, and the preconscious level contains all the memories, information you have about the world, about yourself. So if I ask you to think about your last birthday, so that information is not currently floating in your conscious level of mind, but you can pull that memory from your preconscious level to your conscious level. And then last, below this, is the unconscious level of mind, where we bury all the experiences which are embarrassing, painful, or anxiety provoking. So if you have been sexually abused in your childhood, that memory will be in your unconscious level. You don't like to think about that because that makes you very anxious or it makes you very sad. Okay, so these type of things, any type of having a sexual feeling towards something or someone, okay, and not acknowledging it because you think it can be embarrassing if you mention that to that person. So these type of things which are embarrassing, which are very emotionally disturbing, which are anxiety provoking, they are deeply buried in the unconscious level of your mind. A person who is trained in psychodynamic therapy will try to explore the unconscious level of your mind to rectify the wrong behavior that the individual is going through. Alright, so another very popular psychotherapy is called the behavior therapy. Behavior therapy deeply believes that behavior can be learned. So this includes the maladaptive or wrong behavior also, that behavior can be learned, it can be unlearned, and it can be relearned. That is the main idea behind the behavior therapy. So there are different techniques which are used under behavior therapy, like systematic desensitization, flooding, etc. You will be happy to know that the success rate of this therapy is quite good. Though psychodynamic therapy is still very popular, but the success rate of psychodynamic therapy is not very good. And as of, if we talk about today's time, there are very less psychotherapists left who are exclusively only practicing psychodynamic therapy. So yes, there is an issue with the success rate of the psychodynamic therapy. Yet another very popular psychotherapy is called cognitive therapy. So cognitive therapy focuses on your cognition, or all the maladaptive thoughts you have about yourself, about relationships, about the world, any wrong idea or concept that you have about certain object, person, or life or situation in general. So cognitive therapists try to change that thought and that idea so that there is a visible change in the behavior. Now I'm going to talk about what is CBT, which is cognitive behavior therapy. So CBT is popularly used to treat anxiety and depression. It can be helpful for treating other type of psychological and mental health disorders too. This CBT helps the client or the patient by focusing on the dysfunctional thoughts the person has and then modifying the behavior related to that dysfunctional thought so that the individual is an emotionally balanced individual. Success rate of this particular therapy, CBT, is very high. Now quickly going on to the next therapy, which is very popular, REBT, which is Rational Emotive Behavior Therapy. So here the word emotive denotes emotion. So rational emotive behavior therapy tries to identify dysfunctional emotional thoughts, dysfunctional behavior, and dysfunctional patterns of thinkings and ideas. Irrational thoughts are replaced with rational thinking, and negative emotions are replaced with positive ones. Success rate of REBT is also very high. I'm now going to be talking about humanistic therapy. Humanistic therapy assumes that individuals, that means human beings, are all positive and good by nature, and that we have the will and the power to change our lives and design our lives in the way that we want. This therapy helps in realizing an individual his or her truest potential so that the person can be the best version of himself or herself. Client-centered therapy is a very popular humanistic psychotherapy. And lastly, I'm going to be talking about dance therapy and art therapy because these are also very popular in our country. So dance therapy falls under the category of expressive therapy or creative arts therapy. It uses movement, body movements to encourage cognitive, emotional and behavioral health of an individual. Art therapy seeks to understand the client's condition and help and diagnose the client's situation by means of paint, paper, clay, sand, etc., through which the client is able to express himself or herself freely. And lastly, I would want to talk to you, of course, about my most favorite therapy, which is hypnotherapy, which uses the power of the subconscious mind of the patient so that the patient can get rid of his or her problem completely. And of course, the success rate of dance therapy and art therapy is good, but the success of hypnotherapy is always very high. I would say the highest among all psychotherapies. Best part of hypnotherapy is that it can be used to treat anything, not just mental or psychological disorders. It can be used to treat something as simple as alopecia, which is hair fall problem, or skin related problems, or weight issues. So hypnotherapy is an all-rounder therapy, and I would say it is the king of all psychotherapies. Here in hypnotherapy, the psychotherapist hypnotizes the client or the patient, of course with his or her will, and then uses or harnesses the power of the subconscious mind of the client or patient so that the patient can use this power to help himself and come out of his or her situation or change his existing external reality. Now, to answer the most important question, that how can one become a psychotherapist in India? You will be shocked to know that there is no Indian university or college offering any type of degree, diploma or certification program in any of the psychotherapies. So many therapies are taught only in theory and they form the part or the syllabus of say BA honors psychology, masters in counseling psychology. So the person who is doing masters say in counseling psychology, child psychology, or any type of subfield of psychology will get a fair idea, only the theoretical idea about these different type of psychotherapies. There is no practical training provided by any of the university or a separate degree in say hypnotherapy or a separate degree in REBT or a separate degree in CBT. That is not how it is in our country. Therefore, it becomes absolutely very difficult for somebody who has studied psychology to become a very accomplished practitioner right after completing his BA honors, BSc honors in psychology or completing the masters. Even some individuals who have done their PhDs also do not know very well how to tackle or deal with certain clients or patients because their knowledge is very theoretical. They have never been provided any separate information, practical training about REBT, CBT, hypnotherapy or any other type of therapy. That is one challenge that our Indian psychology students have been facing. So how does one become a psychotherapist in India? For that you have to look for any institution which is running any of the courses in any of the psychotherapies, whichever you are interested in learning, so that you have that practical knowledge along with the theory that you have studied and written your exam. And basically, to become a psychotherapist in India, you have to help yourself. You have to only do all the finding and shortlisting of the course, which is better psychotherapy. Once you have understood your own interest and in which psychotherapy you want to take training into, you can apply for earning opportunities or job opportunities in hospitals, private clinics. You can also work with private practitioners like different type of psychiatrists and psychologists. You can also work in different schools, especially CBSE schools. They always have a counselor. So it is better if you are also trained into therapy along with counseling, or the best option is you can practice by your own self. As far as the salary is concerned, the starting salary can be 10 to 12,000 per month. If you are individually practicing, then what I know most of my friends and other counselors are doing, their rate is 500 to 700 per session. So you can fix your own rate, create your own Google presence and then start your own practice. So but for that, again, you will be needing a proper setup where you can call in your client, and of course you have to take care of your safety also. So it's not good to be alone with someone you don't know until unless you have taken the case history of that patient, that how genuine the client or the patient is. There have been cases like this where the safety of the psychotherapist has been compromised. So you cannot take a risk like that. So you have to, even if you are going to practice independently, you have to be a little careful. Alright, now in this segment of the video, I will be telling you about the different organizations offering courses in different types of psychotherapies. You can definitely explore Udemy. It's a wonderful platform and it is offering online certification in almost all type of therapies. For psychodynamic therapy, there is one particular institution that I want to recommend to you. It is ISTDP Institute, Washington DC, and it has a wing in Hyderabad, India. They offer 1 month till up to 3 years training course in psychodynamic therapy. As far as cognitive behavior therapy is concerned, Endorphin Institute, Pune is offering level 1 and level 2 training in cognitive behavior therapy through their online and offline classes. For courses in REBT, Morphic Minds, Mumbai and Emoticons, Pune are quite popular. For client-centered therapy, Manas Institute, Hyderabad and Heart to Heart, Mumbai are offering certificate courses in counseling and therapy based on humanistic approach. For dance therapy, TISS Mumbai is very well known and it offers diploma and PG diploma in dance movement therapy. For art therapy, Indian Institute of Psychology and Research, Bangalore, offering courses in art therapy. These are certificate and other short-term courses. Antara Arts-Based Therapy is also one such institute which is based in Mumbai, which offers different type of art therapies. And as far as hypnotherapy is concerned, you know that I have done my hypnotherapy course from ECA, and that is what I will recommend for hypnotherapy. And I hope that I was able to answer all your questions related to how you can become a psychotherapist in India. Please don't forget to subscribe to this channel if you already aren't, and recommend this channel to other friends and family members who can find the content useful. Thank you so much for watching. I will see you in another video very soon.